Do you want a normal delivery but feel confused about what to do? Many women believe that normal delivery depends only on luck.
Pregnancy is a natural process, and the body prepares step by step.
In the first 3 months, rest and safety are most important. Light walking is enough during early pregnancy. The best time to start exercise is the second trimester. During this time, the body becomes more stable and strong.
Walking is the safest and best exercise for normal delivery. Walking improves blood flow and pelvic flexibility. Regular movement helps the baby stay in a good position. Breathing exercises help control labor pain.
Light stretching keeps muscles relaxed. Gentle squatting may help pelvic muscles if the doctor allows. Squats should never be deep or forced. Stop exercise if pain, dizziness, or bleeding occurs. Housewives already do helpful physical activity at home. Gentle standing and movement improve circulation. Rest between activities is very important. Heavy lifting should be strictly avoided. Deep bending can strain the body. Good posture reduces back and pelvic pain. Diet plays a major role in normal delivery. Balanced meals keep the body strong.
Iron-rich food prevents weakness and anemia. Calcium supports muscles during labor. Junk and very spicy food should be limited. Fruits and water improve digestion and energy.
Avoid fear and scary delivery stories. With the right routine, diet, and movement, normal delivery becomes more likely.